Hi guys, welcome back to BDI's YouTube channel. Today we're sitting down with Dr. Ali, an NHS locum consultant medical oncologist, talking through his personal experiences, roles and responsibilities as a consultant oncologist in the UK, and his experience transitioning from an overseas healthcare system. Hope this video proves really helpful. Hi Ali, thanks for joining me on this call today. How are you doing? You well?
Hello, Rich. I'm fine. How are you?
Very well, thanks. Nice to see you this morning. So as I said, Ali, the purpose of this call today is just a short question and answer session between the two of us. As you're aware, lots of international medical graduate, oncology doctors, oncologists, sort of come to BDI looking for, their first employment role in the UK or, secondary employment roles once they're in the UK. And often a lot of people from overseas have questions regarding to how the practice might compare to their home country and, how they've benefited from the NHS, the support they might have received from us as well. So I thought, what better to, collate these questions and ask someone like yourself who's sort of been through that experience, because I'm sure sharing your journey as you have will be extremely beneficial to those working towards their postgraduate qualifications and working towards UK practice. Okay?
Sure, it will be my pleasure to share my experience and my thoughts about these aspects of practicing in the NHS as an IMG.
Yes. Okay, certainly. So I think the first question for me was one I received lots and lots of sort of emails and messages with, and it's best poised to, the answer to come from a clinician. What advice would you give to an individual, an oncology doctor who's preparing for their MRCP examinations or their SCE, their speciality certificate in medical oncology?
That's a wonderful question because I would strongly recommend any doctor who is working as an oncologist in any part of the world to take MRCP, UK, and SCE exams. And the reason is the preparation of the MRCP exam enables you to improve your competencies to practice as a safe doctor. The specialty certificate exam covers each aspect of oncology, from oncological emergencies to best supportive care. The healthcare setup in the NHS is a bit different from other countries, and we focus a lot on ethics and communication skills. And especially PACES part of the MRCP enables you to improve your communication skills, and and result in your own satisfaction and your patient's satisfaction.
Okay, fantastic. And when you were preparing, say, for your paces as well, was there anything particularly that you did? Because I know you cleared this examination from overseas as well. So is there anything particular that you did, involving yourself, maybe in an internal medicine team or getting some different exposure? How were you helped to sort of, get that exposure for the exam?
So my first impression about MRCP was that it is a theoretical exam like other exams. But when I started preparing for it, I realized that it is very much clinically oriented and is based on real-time scenarios.
Yeah.
So my trick was to attend medicine rounds and to spend a lot of time in the hospitals, in wards, on the bedside. Another thing what I did is started visiting specialized units, like to prepare the cardiology part of the MRCP. I visited a cardiology institute, and same about the other clinical medicine specialties. So I would like to advise this thing that instead of reading a lot of books, if you spend a good time with the patients, then it can be beneficial in your real exam.
And I think that's a fantastic tip. That's really good. Is there anything else that you wish you maybe knew before preparing for your examinations, when you were going through the process?
Well, Rich, before, as I said, that I realized that it is more clinical exam. So I started with the books in the traditional way and wasted 3-4 months just reading the books at home or in the library. And then I realized that when I practiced MCQ, I realized that I'm not up to mark. And the reason was same. So that was a thing I would advise everyone that don't sit in the libraries or at home with the books. See the patients, and that will make the difference.
Like I said, that's a fantastic point. And one thing then, so before joining the NHS, obviously you cleared your MBBS around 2011. What experience did you have sort of before coming into the UK system? How was your sort of your medical career sort of looked, from MBBS onwards before coming to the UK?
So Rich, as you have mentioned, I did my MBBS in 2011, then did 1 year of house job or foundation year, and started structured training program by College of Physician and Surgeon Pakistan in 2012. So it was a 5-year training program of medical oncology, comprising of 2 years in internal medicine and 3 years in oncology. Then there was a research we had to submit and an exit exam. So after clearing exam, I was granted fellowship of College of Physician Surgeon, which enables you to work as a consultant in Pakistan.
Yeah.
And I did private practice for 7 to 8 months, but I realized that I need international exposure because we cannot practice evidence-based medicine due to the logistics in many parts of the world. You must Then I went to Gulf and worked as a specialist for 14 months. And then I resigned from there, got an opportunity in the NHS, and joined NHS in September 2020. And right now I'm working at Northwick Park Hospital, London, thanks to you.
All right. And that initial job search, of course, I think when we were sort of in contact, you'd come into the UK in your first role. We helped you, at BDI move into the London area into a second role. What was that? What did that job search look like? For you.
So, Rich, if I will start that when I started trying to find my first job while I was out of the NHS in Gulf. So I made a profile in NHS Jobs and Tax Jobs website, and I started applying blindly without knowing anything about the trust, their CQC rating, and other aspects. I didn't know how to negotiate about my salary and other needs. I had no idea that what are my rights. So that was quite frustrating. And it is, I believe, every doctor who is coming from abroad and for their first job, they are same blind as I was. Once you start working in the NHS, then you get an idea of the system, your rights, and what you can ask, and what you are expected to deliver. So for my second job, it was easier. I knew that apart from these websites, there are recruiting agencies. You can directly apply to in the hospitals. So it was easier to apply for the second job, but first job was quite frustrating.
Well, okay. And what would you maybe say, any additional benefits of working alongside, a recruitment provider, especially, some individuals, they have, specific hospital that they're interested in or specific regional area. What was maybe the difference between that initial job search and then, having a tailored job search sort of for you as well?
Yes, because as I mentioned, even if you spend 1 year in the NHS, you don't know the system in that well as the recruiting agencies or other persons who are in this profession for the last many years. The benefit of recruiting agencies is that, and I'm just sharing my experience. Different people can have different experience. That I could tell them that what are my requirements, where I want to locate, and what are the reasons behind that. What I need for my career progression. What is the salary I'm looking for? What is the relocation plan that is in my mind? And then these recruiting agencies tailor such a job plan for us and go to the hospitals that we have a doctor who has these requirements or demands. And then so this really helped because again I would say that we cannot go to every trust and visit them, and even if we visit them we cannot have an idea that how their administration is, how is the working environment. So I believe the recruiting agencies help in this aspect a lot. One of my colleague has got a job yesterday, and she was surprised to see the salary last night.
Yeah.
And I told her that this is your basic salary, and there is 8% on-call rota as well, which she was not aware of. So our doctors even lack that ability to understand the um, offer letter even, that
Yeah.
they don't know what it is. And so the recruiting agencies are really helpful in this aspect.
Okay. Okay. I think that that's a really important thing to look at those differences there. And personal experiences again. For you coming into role, see, you're an NHS locum consultant now. You've got all your UK accreditations, independent practice. Reflecting on that time since being in the UK, what is the best thing for you about working as a medical oncologist in the NHS?
So I must say, NHS is an amazing place to work. We are able to practice evidence-based practice free of cost to our patients without compromising the standards. So that is a thing I loved in the NHS there, and every patient is special for us, and we have multidisciplinary approach where our nurses, our administration, consultants, junior doctors, everyone is focusing only on one goal, and that is to provide best patient care.
Certainly, and you mentioned the fact is it's cost free, and I know some individuals I speak to, when they might be coming over or looking for jobs in the UK, some of the systemic therapies available are financially restricted. So how, when you first sort of came into the UK, did you maybe compare practice in your home country or in the Gulf, as you say, when you were practicing in Bahrain, compared to the NHS as well?
So the beauty of NHS is that even the fancy drugs, they are also available through some funding options. So I was able to use any drug which has documented evidence as per clinical trials. So in Pakistan, sometimes these drugs are not available and even are not registered. We can have affording patient who is ready to pay any price for a drug, but that drug is not registered. So the system is yet developing. In the Gulf, no doubt we had that, uh, you know, uh, opportunity to use any drug. They can bring any drug which is approved a day before for their patients. However, because I was working as a specialist, so I could not make independent patient decisions. And that was one. And what I believe is that career progression is a bit slow in Gulf. This you will listen from other IMGs as well.
Yes.
However, and in the NHS, I believe if you fulfill certain their criteria and they think that you are a safe and competent doctor, they give you full opportunity to make independent decisions. And so here, I believe that I'm able to use every drug which we used to read only in the guidelines and textbooks. So it's amazing.
All right, brilliant. Okay then. So being within the NHS now, maybe reflecting back on when you first arrived in your first role before taking the role in London Northwest, Northwood Park, is there anything that surprised you about oncology practice in the UK in comparison to your previous experiences overseas as well?
Uh, Regarding what surprised me is, and this is something I was not expecting, and I believe I shared with you before as well, that
Okay.
uh, rather than apart from working only as an oncologist, due
Hmm.
to staffing issues, especially in the time of COVID pandemic, we had to work as an SHO and as a registrar as well.
Hmm.
So that was a bit surprising for me in start, because abroad, if you are a consultant, then you are not doing the ward jobs usually. You're not sending the referrals or requesting simple investigations like x-rays.
Yeah.
Here I believe the system is a bit different, though I am liking it now, because I feel satisfied after doing the jobs of my patient as well, and then I can follow them myself. But in the start it was a surprising thing for me. And many doctors who come from abroad, they it is difficult for them to digest this thing in start. However, then eventually, when you know the system, when you understand the system, you actually feel more safe when you are taking care of your patients as a whole.
Okay, I think that's an absolute brilliant answer. Um, I know some individuals I speak to who are coming from consultant positions overseas, they feel quite removed from the day to day. And as you said, you're very much involved in ordering the scans and such in the NHS system. I think that's a really good answer. One question I've had that's been really popular from lots of international oncologists recently is, what does the typical week look like for a medical oncologist in the NHS? Could you break down your typical sort of, I imagine it's a 10 PA rota, your typical week, for those people?
Yes, let me share you my job plan. So Monday morning starts with breast MDT,
Okay.
followed by acute oncology rounds, then our lunch break and my evening clinic.
Mhm.
Tuesday starts with an acute oncology rounds, followed by a toxicity meeting in the chemotherapy day unit, then a
Mhm.
small lunch break, and again a clinic. And Wednesday morning, again, there is a clinic. So it's quite busy start of a week.
Yes.
Then on the Wednesday afternoon, I have free PA to do my clinic jobs.
Hmm.
Thursday morning is dedicated to governance meetings, any audits we are doing, or there are any detics we or incidents we are investigating.
Okay.
Then on a Thursday evening, I do my inpatient ward rounds. Friday morning is dedicated to teaching and training of the middle grade and junior doctors, and there is an upper GI MDT in the afternoon.
Okay.
My weekends are free, where I have time to do any extra locum clinics if I'm keen to do.
Okay. So it sounds then it's quite nicely balanced between outpatient clinics and being involved with MDTs, teaching a bit of self-development and admin time as well. Um, okay, I think that's a really nice comprehensive overview of sort of your week. Um, Maybe a bit more of a personal question in terms of sort of moving into the UK as well as were there any challenges initially that you may have faced and in entering NHS practice or entering the UK and how you overcame them as well?
So I joined NHS in September 2020, which was peak of pandemic.
Yeah.
Uh, so the guidelines were changing, and
Hmm.
we started doing telephonic consultation, which was my first experience. I never did telephonic consultations before. So and the staffing issues due to the lot of NHS staff isolating due to COVID positive tests. So it was quite stressful in start. And the best thing was the support by the trust. So if you go to a trust which is ready to support, which acknowledge and understand the working situation, then they can really help. And I believe my clinical director was really helpful, and they tried to make the things easier for us.
Hmm.
So it was quite challenging, but as and this advice I would like to try give to every doctor who is coming, then the first few months will be stressful for you because you are coming from a totally different healthcare system. But once you get settled, then it is quite easy and there is a system in place for everything.
Certainly. I mean, I think that's a great point. And, it's not just, moving healthcare systems, it's, the getting used to the different systems within the hospital and, the reporting systems and things. So yeah, I think that sort of induction period is really important.
Yeah, exactly. And I would like to add that please ask for support.
Mm-hmm.
And do discuss with your fellow colleagues and the people who work already in the NHS.
Okay, yeah, and oncologists that we're sort of helping get their first UK positions, it's always really important to caveat that they have that shadowing period, they have that induction period, with a clinical and educational supervisor to really help integrate them into the team. All right, last question from the oncology doctors we've been speaking to then. I think this is a really important one. What advice would you give to an international oncology doctor preparing for their first NHS interview?
So my first advice will be to keep yourself up to date with the recent drug approvals and the clinical trials. Second thing is that do read NICE guidelines, especially about the oncological emergencies and a best supportive care. They do ask these scenarios to make sure that they are hiring a safe doctor. They don't bother enough that how many qualifications you have. However, they would keen to know that if you are a safe doctor and what is your treatment approach. I would suggest that do read NICE and ESMO guidelines, and especially about the acute oncological emergencies. This will really give a good impact. And another thing is that you should be aware of the communication skills and ethical scenarios, which we as oncologists commonly face, like breaking bad news. It's a task which we do daily in routine in our clinics. So you should have a grip on these things.
Okay, all fantastic points, I think. And one thing I'm sort of seeing come up and in quite a few interviews as well is and sort of preparing individuals for is the understanding of clinical governance in the UK, as you said, like ethical scenarios and those 7 pillars of clinical governance. So that's sort of been a focus on a lot of doctors I've been speaking to recently, to make sure that they're familiar with those those full 7 pillars that we have in each trust across the UK.
Yes, Rich, and I believe PACES preparation, PACES part of the MRCP, that really helps you. They do ask about pause. They do ask about that if there is an incident in your ward, how you will act. So one should be aware of the working of the NHS and the governance aspects of the job.
Certainly, and what I'll make sure I do is when we transpose this Q&A as well, I'll make sure we put some links into some of those sort of interview supporting questions as well, for any individuals that are going through that. So Ali, that's the questions I've collated from the different oncology doctors we're speaking with. On behalf of them and myself, we're all incredibly grateful for your time as well, and thank you for sharing your experiences with us today. I know that's going to benefit so many individuals that are maybe considering UK practice, preparing, or in the final stages of securing their first role. So thank you very much, and enjoy the rest of your day as well, Ali. Okay.
Thank you very much, Reese. And I would like to say NHS is a wonderful place to work.
Yeah.
And for me, BDI and other played a really, really good role finding a job of my choice. Thank you very much.
Thank you very much, Ali. Take care.
Thanks for watching today's video, guys. I hope it was informative and gave you the insight to a medical oncology practice in the UK. If you are an oncologist and you're looking for either your first role in the NHS or a role to support your professional development as an NHS oncology doctor, please send over your CV to apply at bdiresourcing.com and ask to speak with one of the oncology team, and we'll give you a consultation call to talk about all the available opportunities nationwide for your professional development.